Dr. Chant, you're comfortable with the pubs and gyms opening at a 70% mark? That you're comfortable with that?
Look, as I said, I think the roadmap gives certainty to businesses about what it looks like. I think the Premier's been very clear that this is all contingent on us getting case numbers down and getting control, and that we can have the opportunity to actually do things locally that may respond to outbreaks. So this is not... we would expect that we are seeing case numbers decline at a certain point. That's what the modelling suggests, but that requires everyone to follow the stay-at-home rules and to get vaccinated. And the more vaccine we have in arms, the quicker we will see that decline, and the more people obeying the public health orders, the quicker that decline. Now, obviously, very pleased to give some certainty to the community, but I think that what the Premier has clearly said is if there are local outbreaks, local circumstances, there will be public health measures we may recommend based on our understanding of the circumstances of how transmission's occurring. They will be tailored to those settings. So they may not be geographical, they may be other strategies. So that is open to us to provide those recommendations.
Based on health advice, if cases are too high in a designated area, then this roadmap won't proceed in that certain area. Can you give an indication of what you're considering too high? I think especially people in Canterbury Bankstown will want to know, how low do their cases have to go if that area comes up?
Could I just start by thanking the communities in some of the local government areas of concern that have elevated their vaccination coverage rates amazingly. What I'm trying to say to those communities is we are in some of those communities starting to see some glimmers of flattening. Now, as an epidemiologist, I do not want to call it too early, but I just want to give some hope that if you continue to stick the course, we may well see declining case numbers in some of those areas as we see vaccination rates climb. Now, in terms of local restrictions, if we're seeing an outbreak in a particular town, as the Deputy Premier said, there may be some particular strategies that we would put in place. If we note that, for instance, transmission is occurring in a particular, being introduced in a particular way, we might actually work with those industries to up their COVID safety plans. We may actually work with people to recognise that there's an under-vaccinated group. So there may be some people in certain industries or certain professions where we know the vaccine coverage isn't very high or as high as we would like, and therefore we might work with them. So the public health measures may be geographical based, but they may be targeted. We may be supporting vulnerable communities, increasing access to vaccination. So a suite of strategies, and we will closely monitor.
Dr. Chant, if the statewide R factor remains above 1, will you still be comfortable with this reopening plan from mid-October?
So we're redoing the modelling and we continue to redo the modelling. I think my answer to that question is the solution is in everyone's hands. I am so pleased to see the vaccine coverage tick over, and I think there was a question earlier around how will business know? It's publicly reported every day on the Commonwealth website. And so you can go there and track how many people were vaccinated, you can track the age distribution of who's getting vaccinated, and you can monitor closely our situation. What I'm hoping to see is that we have higher uptake, and I would actually be confident that probably by Monday or Tuesday we'll get to 80%. And what I'm challenging New South Wales residents to be is one of the most vaccinated in the world, because I know that the community of New South Wales believes in the science of vaccine and knows that it is our solution to reducing the harms associated with COVID.
Dr. Chant,
so I actually want to set the target for subsequent week. Wouldn't it be great if in 2 weeks' time I'm standing here and I've got 90% of the New South Wales community first dose vaccinated?
No.